herzlich willkommen. خیلی ما خوش آمدگویی میکنیم به پروفسور کیزیلخان. پروفسور کیزیلخان معرف حضور خیلی از این دوستان و همکاران هست. ما خیلی خوشحالیم که امروز ایشونو در خدمتشون هستیم. Herzlich willkommen, John. Das ist ja, es freut uns, dass du dann da bist.
Yes, thank you very much for the invitation, and I really appreciate to be today with you. I know it's a very hard day that you go through the conference, but you have an amazing program, and my congratulations to the organizations in Iran and as well in Germany. And dear my friends, Holland, you are doing great work. So you choose today for me a really difficult topic to make a presentation, but I will try to my best to be very scientifically and not go through any political ideology behind in any countries, but just to show you how a political crisis in general can affect mental health and the mental health in any countries, not just in one countries. But let me show you first, if you go about mental health disorder, which means there must be any risks that impact any stress, which have, of course, an effect of a mental health. So if we have a high risk of mental health condition, you can expect it's an extreme stressor, and they will maybe have some different kind of impact, and for example, to suffer from depression, anxiety, but another psychological disorder. If you have a lower risk of mental health conditions, and this depends, of course, of your individual vulnerability, but also on family, community, and structural factors that vary over time and space and are experienced different from person to person. It's different, and these conditions is a kind of interaction between individual vulnerability and the stress caused by life event and chronic stressor. So you cannot say one stressor is impact or have an influence of mental health. So even the community, the discrimination, the political situation, but as well the economic situation can have an effect of mental health issue in each person, but that is different. If you see on this slide, we already have this is by the WHO World Health Organization. It shows that 970 million people living with mental disorders. Actually, these data are from 2019. We already arrived at 1 billion people who suffered from mental health disorders. And on the first, you can see is with 31%, they suffered from anxiety disorders, and about 28% depressive disorder, a different kind of major depression, reserve and middle, but also developmental disorders as well, attention deficit and activity like perception problem, bipolar disorder, but autism, schizophrenia, eating disorders, and even PTSD. If you look on the countries, and the higher income countries in general have about 50% of the population is living with mental health disorder. This is very interesting. So you could say they have a good high income, maybe they don't have so much political crisis. Why they have so high risk of living with mental health disorders? If you show the low-income countries, which is a little bit like a red line, is about 11%. So it shows that it's not just a one issue, one topic why people suffer from mental health, which I will go later through on and show you how it's impacted by different kinds of issues. In general, if we divide it in risk and protective factors, we can see that the protective factors, of course, can be genetical factors, like a good resilience and vulnerability, which is given by your ancestors, and you are able to cope more a situation with stress as other people, they don't maybe have this kind of resilience. But as well, this also the social and emotional skill is very important. Maybe also the sense of self-worth and mastery, So it's depend on your personality, on your character, how you deal with some conflicts, for example. And you need, of course, good physical and physical activity as well, physical health, which is one basic maybe to be able to cope more stress situation. Family and community, as well as in Iran and another collective society, sometimes it's much more important than individual issues, like have a good parenting, good secure feeling of security and safety with the family, and positive social networks, a kind of solidarity, and even a place where you can develop your own self. Structural protective factors means economic security. You know you have a good salary, you are not poor, you can have access to food, for example, and you have a long plan. You know, next month or next year, more or less, I will be sure I have a good economic security and can take care of my children, which give you a feeling of security and feeling for the future. And good quality infrastructure means also health structure. You can go to the hospital, whatever you want. You have a good doctors, you can visit them. You have enough doctors as well, psychological, maybe social workers, but also quality of natural environment, which is secure in the situation where you're living. There's no war going on. There's no post-conflict situation. There are maybe not any terrorist organization who or take care on some regions. We had what are facing in Iraq or in Syria or Lebanon, or, you know, the Palestinian problem on Ukraine. So the most important is it also is a feeling of social justice and integration. Sometimes it's a perception, a subjective idea. Yes, a country that I'm living, so we have a good social situation. We can go ahead, and I know there's something as equal income and social protection. And in many, many countries in the world, of course, social as well, gender equality is very important as a fact of positive protective factors. On the other side, if you show what is the risk for mental health disorders, and this can be also genetic factors. It's maybe transfer, it's a kind of transmission of any diseases by your ancestor, your father, your mother, or grandfather, grandmothers, and so you are more vulnerable maybe to have any genetic factors. Low education, as all studies can show this, alcohol and drugs uses, chronic disease, for example, sleep disorders, but also in the family. Is there any violation of the family? Is there kind of neglect, which are maybe children, for example, face and cannot develop and protect them, but also kind of substance use and pregnancy, bullying, being a war veteran, some kind of family is lost, is divided, they have no jobs, urban living, and so on. And structural is the same. And thus we have a climate crisis, which I will go later a little bit more in details, pollution or environmental degradation, but also poor access to services. I am not able to go and get some support by the state or government or whatever. Social, economic, and gender inequalities and conflict forced displacement, which means that we have countries which face war, post-conflict situation, and they are forced to maybe have IDPs, which means internal displaced persons. They have to force living one area in one country to another area, or even they became a refugee and left the country and got to another country, which also causes a lot of stress and as well mental health, like a post-traumatic stress or another psychological disorders. Health emergency means, thus I have access if something is, if I'm sick, if I have an accident or something else, if it's possible to get as soon as possible to get access to the health services, like go to the hospital for emergency and so on. This gives a kind of security. If you came to our topic, which means political crisis and mental health, that means in general, if there are any global threats on mental health, so we need a major structural and see what kind of stress we have and how it impacts the well-being of the people. So they affect the whole population. It's just not one group. So if any political crisis in one country, so more or less it's impacts the most population. And so we have a kind of threat in political crisis. One is the general political situation, which is not safe, which is not clear. Maybe we have different kind of ideas and political groups who are fighting each other. We don't have one idea of a system, which can be religion, it can be democratic, it can be anything. But it should be very clear what is the political situation and is the population satisfied with the situation or not? And the second stage, of course, the economic downtowns are very important, but also the social polarization. Are many different groups in one country, ethnic groups, religion groups, who are not able to live in peace with each other, or there are any kind of discrimination, even racism that we see in America with the black people, for example, or in Europe with migrants, they are facing a kind of discrimination of racism, which also shows in many, many studies that impact also the mental health. Many of the people are suffering from PTSD or depression. Public health emergency, as I mentioned, but also humanitarian emergency is important, and displacement as well as growing climate crisis. So these factors can be seen as a part of political crisis that should be taken into account if we living in a country and see which kind of topics or more topics are not well organized. We don't have maybe some problems and differences, and this can cause then a kind of not happiness with the problem by the population, and then it depends how much is a risk or how much is a stress, which can cause then different kind of mental health problems. Global and regional threats is also important. Many of you remember the COVID-19 pandemic, which was also a political crisis, not just a pandemic crisis or medical, because the political structure in the country, as so far I could see in the world, in the global world, was not able to somehow handle with the COVID, to give the right information to the people, have a good health system to support the people. This caused a lot of anxiety, of fearnesses. Many people died and nobody had an idea what will happen the next time. Still, we have a kind of long COVID problems which is not solved. And this was really one of the greatest problems worldwide with political problems, because the politicians were not able to get control of this COVID pandemic and not to able to take care on the people and give them the right information, right time, but also the health system was not able and maybe also not ready, because nobody expected in such kind of wideness that this pandemic will cause worldwide all people and bring a lot of deaths and thousands of deaths. The current situation, of course, even especially I'm talking on the perspective of the Europeans. I'm living in Germany and in Europe, and the Ukraine and Russia war is one of the most topic issues that always we follow in the media, and it's give it to the people a kind of anxiety, insurance, what will happen the next, will be this widespread, will we have in Germany or France next time, maybe also a problem. The people are not care, even the problem with energy, with money, with salary. So even the war between Russia and Ukraine impacts the whole Europe, maybe the world, and this can cause by each person kind of stress. And regarding this stress, they maybe are not able to deal with them. And so we have a kind of political crisis, like, let's see, this, like other structural determination, many of the global and regional threats to mental health interact with each other. So we cannot take just economic. So we have to see how is the economic downturns. This can cause displacement because they are not able to get money. They are not able to take care on the family. So one family say, okay, I'm not able to work here, I will change and go maybe to another places. So this is a kind of displacement, in turn, of course, more social polarization and fighting who will get more the best or be able to have a job or even to have more energy or more space, whatever. So it can be cause also conflicts, a social conflict between people groups, which also then and later have a psychological effects on the people. Together, political crisis can heighten the risk and compound the burden of mental health and condition in any country. So there are no differences. As I mentioned, economic crisis is as well as unfortunately associated also with increase in suicide rates, which means if there are people not able to have a job, they are not employment, they are not able to take care of the family. This causes kind of depression, anxiety. Maybe they don't have a kind of hope that will be better. So what the people will or a person will do, maybe they will use drug abuse if that's possible, but probably also they can be managing effects on income, security, and social networks. So we know from many studies in the world that economic crisis is very close associated with the increase of suicide rates worldwide. The structural factors means how is the country organized and is possible positively to support their own people in different ways. And this can be a social, cultural, geopolitical environment surrounding, such as infrastructure, inequality, social stability, and environment. So the structure of the good structure or structures, factors of the countries show how good they are in political or not political, if they are face a political crisis or not crisis. So there's a kind of mirror. If you have a good political situation, a good country who are able to handle this country with the people, the structural factors are more or less very positive. And the opposite, if we don't have this shape, of course, the condition of daily life, access to basic services, commodities, including food, water, for example, shelter, health, and the rule of law is also important for mental health. Is there any injustice or justice regarding one special group or many groups or different kind of ethnic groups? Security and safety are important, and structural factors as well. And prevailing beliefs, norms, and values, especially in relation to gender, race, and sexuality, can also be highly influential. And don't forget, of course, and this is important, we are living maybe in a very global world, but sometimes we forget that legacy of colonialism influences still. The multi-structural factors are very important. So what the colonialism historically did in this country, and still we are talking about sometimes of transgeneration traumata, which can be transmitted trauma to the next generation, which may be caused through colonialism or doing kind of changing this culture, killing many peoples like genocide and massacres. And this can be even after 100 years or 150 years can influences this kind of the community and the social community or the country. In our researches regarding the significance of justice in psychotherapy also shows that the people who are living under different kind of law, or they have at least a perception of injustice. They can be a minority, they can be an ethnic group, they can be a religion group, this can be also cause a political issue that develops a subjective idea that the world is not okay. The world is not fair. We already have different kind of, we developed a questionnaire to measure the perceived injustice of people who have experienced violence and war in conflict areas. This inventory is also checked in Iraq and Syria and now in Ukraine to do, how is the feeling of people there? Say, no, the world is not really injustice. And it's impact me and my mental health situation. And I'm not able to understand the world, how the world is so cruelty. I worked with many survivors of genocide in Iraq and even in Germany, and this is also a typical issue of mental health regarding injustice. So maybe we have to also, as a psychotherapist or psychiatrist, to take more care or take an account about the situation. How is the humanitarian situation? And just give you an amount in 2022, 274 million people were estimated to need humanitarian assistance. So it's a 1/4 to 1 billion people, so which is marking the significant rise of, it's a rise actually. So the situation shows it will not rise, so it will more rise. The situation of humanitarian assistance will be needed. The people with serve mental health, especially in different countries, have a mental health condition, are extremely vulnerable during the after emergencies. Risk to mental health, especially like violence and loss, as well as poverty and discrimination, overcoming food insecurity, and the breakdown of social networks are also widespread in humanitarian emergencies. So you can see on average 1 in 5 people in settings affected by conflict have mental disorders, and this is something that we have talked about. Even the climate crisis became more and more important. Even if scientists 20 or 30 years ago mentioned this, we didn't take care. But now we are living really in a climate crisis. I was 2 days ago in Iraq, and we can show that we have a lot of raining, which was not expected in May or in June, that we have a raining. There's a calm of areas until Basra. It became like a line. There's no water anymore. It became like environment has been changed, so we can see it. It will be changed, and this kind of temperature rising, air pollution, prolonged droughts, and gradual spread of climate-sensitive disease will or already started to impact our situation. And this will be also long-term affect the displacement in the countries. So maybe in Iran, Iraq, wherever, if this will be continued, we will become some area like a desert that people were not able to live, and they will be forced to leave these areas. And this will cause a new conflict even in one country, but also another country. Maybe they have to leave because the people and the person and family want to survive. So through the climate change, we will have also an increasing of political problems and a political issue. And this will be, in my opinion, also arise suicidal behavior, but also another health condition will be more worse. This means political crisis causes growing vulnerability, and this means also distrust is a very important factor, this decreased optimism. And if people in a country have no optimism and no hope for what will be the better situation, they will defend themselves, they will be not more open, and the society will not able to work collectively as to do it better with a hope, and this will have an effect of mental health. Just give you just an idea what can be happen. Even the vicious of cycle between poverty and mental health in a household will exacerbate its mental health. Poor parenting situation is very important. How is the bonding? How is the relationship between the family and children? Poor education will not have a good access maybe to get a job, for example, to the system, or failure in schools. Domestic and interpersonal can be arise that we can see in countries with different kind of ethnic problems, but also of poverty. And this reduce, of course, livelihoods. And mental condition will impact them. So we will have a rise again of depression, of anxiety, of PTSD, of a different kind of another psychological disorder, plus maybe also alcohol and drugs that we can see in different kinds of countries. So you will not believe, as I mentioned, in Iraq and some areas, the use of drug is so much rise in the last 5-6 years, and they have no one addiction hospital, for example. But the children and young people, especially between 12 and 16 years, it's a rise about 20–30% of the school in schools that people use drugs, different kinds of drugs, of course, but this is the problem that we have to prepare for. Risk-taking behavior, self-harm by youth people, but also suicide. So it's more or less, if you came to the summary, I look on my time, we have to invest in mental health, and this can be reduce the situation and give peace in a country. Transformation in mental health is needed to stop human rights violation, whatever will happen, even by people with mental health condition, but as well, the basic is a peaceful situation without any human rights violation. In any country, there's no expectation. If you have war, if you have the feeling of human rights violation, if you are not for the feeling of freedom, you will be not a good part, a member of this society, and this society will be not able of a healthy society. And a healthy society is a basic for a good future to living together. Improving people's mental health improves educational outcomes and participation in workforce, and that will be more productive. Investing in mental health, meaning investing in strategies. The state is responsible to do more for the mental health situation for the people, and this will benefit also the state as well, the whole people. It will be, as otherwise it will tackle stigma, discrimination, abuse, and address underlying social and economic realities that shape people's mental health. So in general, we need a good public health situation in the country, and a public health situation with mental health is a guarantee or the basic of a health society. Thank you very much.
Thank you, danke, John, für diese ausführliche Erklärung. Ich frage mal, ob die da Fragen haben. اگر که سوالی نیست تا ما بریم به سخنرانی بعدیمون. آیا سوالی تو این زمینه وجود داره؟ اگر سوالی هست هم میتونید خودتون مستقیم انگلیسی سوال کنید یا میتونید به من به فارسی بگید تا من ترجمه کنم. Okay. Also, vielen Dank, John.